I struggled with nasal polyps for years. I had congestion, trouble breathing, and even lost my sense of smell. I had 2 surgeries during my treatment for nasal polyps. During that time, I tried oral steroids and antibiotics to keep the polyps under control, but my nasal polyps kept coming back. That's when my doctor brought up DUPIXENT as a treatment option.
I see many patients who suffer from CRS with NP, like Mark. When a nasal polyp patient comes into my office and they've failed other treatment measures, I'll bring up DUPIXENT. I tell them that DUPIXENT is an add-on biologic treatment that specifically targets underlying inflammation.
I listened carefully to what my doctor said about DUPIXENT being a biologic treatment, and I liked what I was hearing. But I was cautiously optimistic. I had tried so many things, and I was really hoping this could work for me.
My patients have similar concerns to Mark and will ask me if DUPIXENT could work for them. I tell them that we have many other patients with nasal polyps that have been through this treatment regimen, and the clinical trials saw positive results. Patients I've treated with DUPIXENT have had their smell improve, experienced less nasal congestion or breathing better, and their nasal polyps have shrunk without needing additional surgery. But of course, everyone's experience will be different. I also always make sure that I talk to my patients about the benefits and risks of treatment.
I did some research on my own, thought about it, and decided to give it a try. Before I started DUPIXENT, I told my doctor about all the medical conditions I had and medications I was taking. My doctor and I talked about the potential benefits and risks of treatment, including the most common side effects, such as injection site reactions, and some serious side effects, including allergic reactions that can sometimes be severe, eye problems, inflammation of your blood vessels, and joint aches and pain.
My patients are often hesitant to try DUPIXENT, and one of the main concerns that I hear is that they're afraid of using an injectable medication. DUPIXENT is an injectable medication that is a biologic. It works differently from other medications, such as oral steroids. I explain to my patients that most biologics are given by injection.
When I learned that DUPIXENT was an injection, that was a little bit worrisome just because I hadn't ever done an injection before. My doctor explained that I would be trained on how to properly inject, and my wife could also be trained to help with my injections. In my doctor's office, I was given literature about DUPIXENT and how that would work, and was referred to dupixent.com.
Like Mark's doctor, I explained to my self-injecting patients that before they start DUPIXENT, we will bring them into the office and we will train them. I really want my patients to feel okay with their injections. In my experience, most patients become comfortable with injecting over time, but everyone's experience is different.
Another concern I had was around cost. Thankfully, my doctor told me about a patient support program called DUPIXENT My Way. They explained that the DUPIXENT My Way patient support program could potentially help me reduce the out-of-pocket cost of DUPIXENT with the DUPIXENT My Way copay card. They can also answer any questions regarding insurance coverage for treatment and help teach patients how to receive and stay on track with DUPIXENT.
I feel it is very important to have an open dialogue with my patients. It's rewarding for both of us when we find a treatment option that works for them.
My doctor was great at keeping me involved in the decision-making process. It was very much a collaborative experience. I'm grateful that together we ultimately made the decision to start treatment with DUPIXENT.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT, are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. To enroll or get more information, call 1-877-311-8972 or go to mothertobaby.org/ongoing-study/DUPIXENT. Are breastfeeding or plan to breastfeed? It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have CRS with NP and asthma and use an asthma medicine. Do not change or stop your corticosteroid medicine or other asthma medicine without talking to your healthcare provider. This may cause other symptoms that were controlled by the corticosteroid medicine or other asthma medicine to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider, or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, joint pain, general ill feeling, itching, skin rash, swollen lymph nodes, nausea or vomiting, or cramps in your stomach area. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an eye exam if needed. Inflammation of your blood vessels. Rarely this can happen in people with asthma who receive DUPIXENT. This may happen in people who also take a steroid medicine by mouth that is being stopped or the dose is being lowered. It is not known whether this is caused by DUPIXENT. Tell your healthcare provider right away if you have rash, chest pain, worsening shortness of breath, or a feeling of pins and needles or numbness of your arms or legs, or persistent fever. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with chronic rhinosinusitis with nasal polyposis include injection site reactions, eye and eyelid inflammation, including redness, swelling, and itching, sometimes with blurred vision, high count of a certain white blood cell, eosinophilia, trouble sleeping, insomnia, toothache, gastritis, and joint pain, arthralgia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. Please see adjacent links for full prescribing information, including patient information.